Good morning, guys. Happy Monday. Today I'm going to talk a little bit about acne. I think I've done this in the past, but honestly, I can't remember, so I'm doing it again. And I might have new information today if you've watched a video in the past, but I just felt like this has come up a lot, so I wanted to chat about it today. So I'm going to talk about adolescent acne and child acne. This is a little bit different than adult acne and might be treated a little bit differently because children and adolescents have a little bit more sensitive skin. So my biggest takeaway here, guys, is less is more. So sometimes the more you try to do and the more products you're putting on, it can actually make the skin very angry and flare up. So I think you want to keep that in mind, especially when you're trying to deal with your teenager's acne, is don't go buying a ton of products and trying to put everything on at once, okay? So I'm going to go through some stuff and some simple steps. I want you to know I don't have any type of financial relationship with anything I'm showing you. These are just products that I like, and they all happen to be from the same brand. So, but they're very mild and they're very simple. So step one, you want to wash the face twice daily, okay? Using a simple, mild face wash. I'm going to show you two of my favorites here. My all-time favorite is this CeraVe Hydrating Cleanser. This is very simple, very mild. It's not fragrance or anything. So if you can use this one morning and night. Now, sometimes it's hard to get kids and teens to wash their face in the morning too. So I think nighttime is probably one of the most important. So I'll show you that one first. I like that one a lot, and it's for normal to dry skin, okay? Another one I like is this foaming facial cleanser. I will tell you though, this one I've noticed, so it's for normal to oily skin. So if you think about that, the other one was for normal to dry. This is normal to oily, which means this one's a little bit more drying. And that's the thing I happen to notice with some people is it might be a little bit too drying for them. But if you are super duper oily, then that could be something that you use. So these are two of my favorite face washes to use, okay? If you feel like the cleanser alone is not helping improve the skin and you still have lots of spots after a couple weeks of use, there are a couple other cleansers you could put into the mix here, okay? Now these look very, very similar. If I hold these up, very similar, but they're actually different, okay? So you really have to read the ingredients here. So this one, this Acne Control Cleanser, has 2% salicylic acid in it. This one, this Acne Foaming Cleanser, has 4% benzoyl peroxide, okay? So this one, this salicylic acid, this 2%, I think this is a nice starting point. It's not going to be as drying as this benzoyl peroxide. It's a little bit lower percentage too, and we always try and start lower in kids. So this could be one you maybe sprinkle in 2 to 3 times a week. Eventually could work up to daily use, but I don't think you'll have to use it daily. I think you'll be able to use some of the other cleansers with it, okay? So this is a nice little face wash. Something to keep in mind with anything you find that has benzoyl peroxide, it is going to bleach towels, pillowcases, anything like, so if you wash your face with a benzoyl peroxide, come out of the shower, dry your hands, those things will get bleached. So if you have like some dark navy blue towels, they're going to have some white white spots all over them. So if all of that is not working, there is something else, and I don't have a sample here to show you. We have some to help with if you're getting a lot of acne and that combination's not helping. We can use something called Differin gel. This used to be a prescription, but now it can be bought over the counter. I definitely want you to talk to your pediatrician before you would buy that and start using it so they can explain exactly how to use it, okay? Because it's not like we don't use a lot. You use a very tiny amount, and we want to discuss with you how to apply it, how often to use it, okay? So if you're going to buy that, which it works very well, you just need to have a discussion with your pediatrician first on how to properly use it, okay? Another thing I just want to show you, if your face is getting super dry, which it might with some of this, it's good to just use a daily lotion anyway. So if your child wanted to, first thing in the morning, put some lotion on, I know this, it says PM facial moisturizing lotion. I recognize it says PM, which means evening, so you can use night or morning. The difference between AM and PM when you're looking at this lotion, AM is going to have the sunscreen in it, and PM does not. So that's the biggest difference. So you can use either one you want depending on your lifestyle for that day and what's happening in your life, which one you want to use. But I like both of those a lot, okay? Extra tip for our teenagers who are super active and very sporty and doing a lot of stuff where they're sweating a lot, if you're out doing your activity, you get super sweaty, try and wipe that sweat away off your face or hop into the bathroom afterwards and just splash some water on your face to help kind of rinse those pores and not letting your face completely dry with all that sweat and suck that bacteria back into the skin. Okay? If you guys have any questions, just comment below, and I hope this was helpful for you. Bye!